Hi. So I have a doctor's appointment in about 30 minutes and I showed up really early. So I decided to kind of do a little 6-week update, even though I'm almost 7 weeks. Technically, today's Wednesday, Friday, I'll be 7 weeks post-surgery. But there's been a lot to talk about. So I wanted to go ahead and go over a couple of the things since I haven't done a video update since 4 weeks. Let's see, what happened at 4 weeks? Did we know that I wasn't diabetic anymore? Because that's super exciting. No more medication on the diabetic side. In fact, I know that I've shown my mountains and mountains and mountains of pills. But this is all that I take now in the morning, plus one antacid pill, because that's a pre-surgical thing. So here is my beta blocker right there. It's in half because it's a little big. This is my lisinopril, which is for no, I take that back. That's the spironolactone, which is supposed to help with heart function of some sort. These are my vitamins. One is B12, one is biotin, and one is a general. And then there is something, my spironolactone, my lisinopril is missing, which looks like basically these two things are what's missing out of there because I've already taken them. And these are the only things I take at night now. So there's been some pretty big improvements in my medications, which has been really, really nice. I actually have my cardiologist appointment this morning because he wanted to see me about a month post-op. Excuse me. And I forgot to schedule the appointment until 1 month post-op, so I had to wait a little while longer, which is fine. I do have some things that I want to discuss with him. For example, I went back to work a couple weeks ago. I went back to work on February 1st, and today is the 15th. And I have an increased arrhythmia since I went back to work. So it could be stress related, it could be activity related. I'll talk to him about that. Maybe he'll do an EKG and see if there's anything that shows up there. Eating has gotten a lot easier. Technically, the 6-week post-op and beyond, you can pretty much start introducing all foods as you are able to tolerate them. So you just do a little bit here and there. And hold on a moment, somebody's walking by and talking. I was parked over there before, and valet's coming around going, well, this is all valet parking, and there's no signs. Like, if you look, there's no posting that says valet parking only, except right here it says this level is patient and visitor parking only. So whatever, they need to post better signs. Anyway, so eating definitely gotten better. The biggest thing on the eating is I'm starting to get quite an increase of heartburn, or more acid indigestion than heartburn. Post-surgery, you do get a Pepsid AC prescription that you have to take for 90 days, and that's to help, my understanding is to help the stomach adjust to producing less acid, because it used to produce acid for a big stomach, and now you have a little stomach, and it needs to adjust to producing less, and the acid reducer pills are supposed to help. It seems like 6 weeks hit, and I got a lot of indigestion. It's not like heartburn, it feels like indigestion, and eggs amplify that, so I've backed off of eggs a little bit. And other than that, I can't figure out anything else that triggers it. There is popsicles help a lot. I'm still kind of eating 1 to 2 popsicles a day, which when I saw my surgeon last, he said was fine. They're sugar-free, just popsicle brand popsicles, the orange and grape and cherry kind. So I think the coolness helps with that, and I don't know if the ice kind of helps neutralize some of the acid in my stomach. Flexibility. So I have noticed that I am able to move a lot better than I was before. Now, with 38 pounds gone, obviously there's less bulk to restrict movement. That's exciting, by the way. 38 pounds. At my 6-week mark, I was 37 pounds down. And so now at, another 4 or 5 days, it's a little higher, but that's significant. And I'm very happy with about 3 to 4 pounds. It's about 4 pounds a week loss. The way I look at it is losing weight is not my goal. It just happens to be a side benefit of being healthy. So being healthy and improving all of my medical issues is my goal. So anyway, the flexibility is increased. Like I can get down on the floor easier and get back up easier. Sitting on my knees, it makes a big difference. There is, I was climbing up on something this week. We were at the beach. My son was in town, so we went to the beach and we went, walking down to the beach. And there's been a lot of storms lately, so there's lots of debris on the beach. So you have to kind of climb over rocks and tree stumps and whatever else to get there. That was easy. There was no... I was more worried about my dog than I was about me because, well, my dogs. One, I have a tiny little dog who is only like 10 pounds. And she, she's little, so she can't get very far. And then my other dog is elderly and not good health-wise. And we really were watching her to see how far she could go and still be able to get back. So anyway, I didn't have to worry about myself at all. My husband even noticed. He's like, you've done all this walking and have had you haven't been out of breath. You haven't had to stop for breaks. You haven't had to pause to breathe. And he's like, that's pretty amazing. I've pretty much given the okay to start more exercise besides walking. And I'll tell you, while I'm okay to do that, I have started planking. I really want to work on my core strength just because that then affects the rest of your body so much. But I'm really nervous to do anything else. And I'll tell you why. Because my hernia repair was pretty substantial. They did not do a mesh repair because he said with the rapid weight loss that it really wouldn't be any good. And I'll have to, as it is, I'll probably have to get another repair in a year anyway. So with that, I'm a little leery of having to do more weight training exercises just because I'm kind of nervous of creating a higher risk for hernias. I've had 2 hernia repair now. I really don't want to have to get an emergency one again, but I can understand if I need to get the repair repaired because of body changes. I can understand that. I just am a little nervous of creating an emergency type of situation, which weights, can do, and I'd like to try and avoid that. So anyway, that's just my little update. I'm a little better time-wise now for the doctor, so I'm going to go ahead and go in. But thank you for listening. If you have any questions, again, put them down in the comments. I'll try and address them. And I will talk to you later. Bye.